This public service announcement is on using psychological first aid to help stabilize victims of a catastrophic event and to de-escalate acute distress in the aftermath of a disaster. Psychological First Aid, or PFA, is a free course offering CEUs that can be accessed through the National Child Traumatic Stress Network and is supported by SAMHSA. It is an evidence-informed modular approach that can be delivered by mental health professionals and other disaster response workers. The goal of this service is to help victims in the aftermath of a disaster to reduce initial distress and to foster adaptive coping. It is the psychological health analog to physical first aid and recommended by volunteers working with the Red Cross. PFA helps to stabilize victims, mitigate symptoms, and facilitate access to supportive care. This is done by establishing a connection with the survivor, gathering information on their immediate needs, helping make social connections, and fostering adaptive coping. PFA teaches how to identify the cognitive, emotional, social, and physiological reactions that may accompany experiencing a catastrophic event. Exposure to trauma affects each individual differently and may be impacted by the victim's age. PFA assists with identifying and assisting victims across the age range and with different developmental levels. There is an accompanying field operations guide that provides guidance to those delivering PFA on helpful verbal and nonverbal behavior to use when assessing for trauma and providing assistance based on whether the victim is a child, adolescent, parent or caregiver, older adult, someone with developmental disability, and even a first responder. The core components of PFA are to make contact with those affected by the catastrophic event and to engage the victims by listening and providing safety and comfort. Your goal is to provide services that help to stabilize victims by helping to meet their immediate needs, such as providing food, shelter, and assisting with reuniting with family, connecting the victims to their social supports, providing strategies for positive coping, and to link the individual with needed services. Skills that PFA teaches include how to remain calm in the face of a disaster, use empathic listening and reflection, and how to ask relevant questions to help victims establish a sense of normalcy and routine, as well as to identify ongoing needed services. You will learn how to identify the victim's most immediate needs, clarify the needs, discuss an action plan, and act to address the need. Opportunities for social supports that can be offered include practical problem solving, emotional understanding and acceptance, sharing of experiences and concerns, clarifying reactions, and sharing information about coping. As a provider of PFA, you will briefly assess for behavioral, emotional, physical, and cognitive symptoms associated with trauma. Some of the signs and symptoms associated with trauma include increased or decreased activity level, difficulty sleeping, numbing, intrusive thoughts, irritability or anger, confusion, somatic symptoms, sadness, anxiety, and vicarious traumatization. You will assist families with providing psychoeducation about common physical and emotional reactions, teaching simple relaxation techniques, assisting with anger management, helping with sleep problems, scheduling positive activities, and engaging in promoting positive self-talk. Parenting strategies can also be provided related to helping infants and toddlers, preschool and school-aged children, as well as adolescents. Guidance is also given on how the PFA provider can address alcohol, medication, and drug use in the immediate aftermath of a disaster. You can provide PFA in an individual or group setting and in a variety of settings, including shelters, community centers, and places of worship. PFA is appropriate not only for survivors of the disaster or catastrophic event, but for those who have regular exposure to those affected, those with pre-existing conditions who are impacted by the catastrophic event, and those with multiple stresses, including those who responded to multiple disasters in a short period of time. Examples of situations in which PFA can be provided include healthcare workers during a pandemic, natural or man-made disasters, mass shootings, and civil unrest. You can assist beyond the aftermath of the catastrophic event by connecting to social needs services for immediate needs and behavioral health services for long-term needs.